Welcome to TPMG Health Talk. Join us for valuable insights and practical advice on health topics that matter to you most, delivered by our top medical professionals. At Tidewater Physicians Multi-Specialty Group, we're dedicated to providing high-quality, physician-directed care to the Hampton Roads community. Subscribe now and visit mytpmg.com for more resources. Now let's dive into today's episode. On today's episode, we're excited to welcome Dr. Richard Parisi, a distinguished expert in sleep medicine here at TPMG with over 30 years of experience in internal medicine, pulmonary diseases, and sleep medicine. Dr. Parisi is fellowship trained and board certified, bringing a wealth of knowledge to the table. His dedication to helping patients overcome sleep disorders and improve their rest is truly inspiring. 30 years. It's amazing. Thank you for joining us, Dr. Parisi.
Happy to be here with you.
Sleep is essential for everyone, obviously, but getting consistent quality sleep can be really tough, and it varies from person to person. What are some common sleep problems specific to working professionals, parents, older adults that you encounter, and how can they manage these issues effectively?
Well, sleep problems are very common, as you said, and it varies over the course of your life and what else is going on with your routine. In children, getting them into a regular routine at night is an important health habit that we encourage everyone to instill within their families. But as they get older, things do change. Certainly in teenagers, they have other interests and demands on their time and start delaying their sleep onset till later in the night, and then have a natural shift in their normal sleep schedule so that they're more inclined to sleep later in the morning. And that doesn't always work when you're in school or when you're working. So you have to make some conscious effort to retrain yourself to get the sleep that you need by going to bed a little bit earlier, by getting up at a specific time and being consistent with it. And then as we get older, some people do shift work, which is a huge problem. I talk to folks all the time who do night shift work or rotating shifts, and it's very difficult for them. I explain that humans are made to sleep during the night and be awake during the day, and you can do it the other way around, but it's a big challenge, and there are a lot of things that have to be done to help you adapt to that.
Yeah, my husband works morning sometimes, overnight some days. He can never get a consistent sleep schedule. It's really kind of throwing him off. I feel like a lot of people in this area have, construction, military. How do you have them keep consistency, if that makes sense?
Well, it is a big challenge, and it depends on what the schedule is like. But there are certain things that can be helpful for shift workers. For example, trying to avoid excessive sunlight, especially in the early morning hours. A lot of folks who work overnight shift are indoors, and then they go out in the morning and they're exposed to bright sunlight, and that has an alerting effect. That the light exposure tells your brain it's time to be awake. And so we tell people to make sure you have some good dark wraparound sunglasses to wear on the way home from work. When you do get home, make sure you stay in dim light. Just do whatever you need to do. Have a light meal, and then prepare yourself for bed. Make sure you have a room that's dark and cool and quiet. Blackout curtains are always important. So those are the kinds of things we tell folks. Using caffeine during the first half of your shift is not so bad, but you'd want to make sure you avoid that later on.
Interesting. Yeah, because he comes home and he takes caffeine. I was like, I don't think that's very effective for your sleep. But again, it varies. He has to adapt that change. Like I had a shift where I was 3 days a week, 3 to 11 p.m., and then 2 days a week, midnight to 8 a.m. And I don't even remember how I got through that. I didn't last very long at that job.
Well, it gets increasingly difficult as you get older, too. And there's no one right answer on that. For people who really have to stay awake during the night and struggle with that, sometimes we actually use medication to help with that. There are medications that are specifically approved to help wakefulness during shift work.
What are some of the most surprising facts about sleep that most people don't know?
Most people don't understand that sleep is important for your overall health. That during sleep, there are changes in your hormone levels, in your metabolism, your cardiovascular function, and all of that has to be synchronized to your sleep-wake schedule in order to remain healthy. So people who don't sleep as much besides being more tired later in the day, are more likely to have diabetes, are more likely to have high blood pressure. Weight gain can result from inadequate sleep. And sleep disorders, physical sleep disorders like sleep apnea, become more common as you go on with that poor sleep schedule.
I love that you brought that up because that is something I was thinking about. Is it seems to be sleep apnea has become more prevalent in a lot of people. Maybe I'm wrong on that, but it just seems like the more people I talk to, the more they have sleep apnea. Is that something that you've noticed recently?
Well, it is a very common problem, and we're recognizing it more commonly because of the varied symptoms that occur. But we know that sleep apnea affects about 10% of adults, so that's very common. The most common risk factor for sleep apnea is weight gain. So as the population has increased in body weight, obesity has become more common, we see a lot more sleep apnea. But it's not just that. Sometimes just the shape of your airway, the way your tongue and your jaw and your palate fit together can make you more susceptible. So even folks who are not overweight are still at risk for developing sleep apnea. We still screen for those symptoms.
Right. What are some of the most common symptoms? Someone who thinks they have sleep apnea, what would kind of be some of the signs?
Symptom number one is snoring. Almost everyone who has sleep apnea does snore most of the time. And snoring occurs because your throat begins to collapse during the night. So as that happens, your soft palate will start to vibrate, causing that snoring sound. Now, about half of all men and about a quarter of all women snore at least sometimes. But if the snoring is getting louder, and if there's any sign that the breathing pattern becomes more erratic, then it may be a warning sign that sleep apnea is developing. In addition to the snoring, sometimes there are actually pauses in breathing that someone will become aware of.
Well, that's alerting.
Yeah, well, if you have an observant bed partner who sees that, then that's a very important clue. But we don't always hear that because, of course, whoever else is there is trying to sleep at the same time. Snoring and sleep apnea tend to be worse when you're lying flat on your back, and so one of the treatments that we recommend for very mild sleep apnea is just avoiding that position. Besides the snoring, sometimes people will wake up with headaches and that's usually a sign that your oxygen level has been declining during the night. Of course, the quality of sleep declines over time. So people wake up feeling poorly rested. They get tired more easily during the day, have more difficulty concentrating. Memory problems can develop. And there are a whole variety of physical disorders that can result from having sleep apnea. So it's a risk factor for developing high blood pressure, heart disease, diabetes, strokes. So lots of good reasons to get it taken care of and take it seriously.
Absolutely. Well, it's interesting that we even have to say that we should take sleep seriously. Like you mentioned earlier, people do seem to put sleep on the back burner. Why do you think that is?
I think it's because it's something that people view as private, as not affecting their daytime function as much as they realize. And, because, they're not necessarily aware of what's happening to them, they're physically during the night, they just don't pay as much attention to it unless somebody else is complaining and telling them about it.
For someone who is having trouble sleeping and is not putting their priority on that's what they should improve upon, what do you tell people? What do you tell patients to encourage them to come in?
Well, if you have questions about the quality of your sleep, especially if you have daytime sleepiness, then it's definitely worth speaking to your physician about. If your primary physician doesn't have a clear answer for that, then meeting with a sleep specialist like someone in our office, it can be really helpful, I think.
Well, you mentioned,
I hope so.
Yeah, oh my gosh, absolutely. Well, you mentioned sleep issues can be connected to other health conditions, and while many solutions involve habits, routines, knowing when to seek help is crucial. I know a lot of people would say, well, I have like a sleep tracker and all these kinds of devices that help, and I don't need to go. But what are your thoughts on the technology, the wearable? I mean, I'm literally wearing one right now, and if I don't want to show you my sleep because it would not look good. But, what are your thoughts on those?
I like it. I'm happy to see people paying attention to their own sleep pattern And the data that you get from an Apple Watch or from any other sleep tracker can really be helpful. I'm happy to look at that when folks come into the office. They often have questions about it, and some people will misinterpret the data that they see. I had someone just the other day, for example, who was very upset about the quality of her sleep because her sleep tracker was telling her that she was only spending 2 hours a night in REM sleep, and she thought she needed much more than that. And I explained that REM sleep only accounts for about 20% of the night, and that's really okay.
Wow. Yeah, actually, that's a great segue because I do that too. I look because it gives you the sections, right? It gives you REM, deep. What are the levels of sleep that we need to get throughout the night?
Well, there are two general stages of sleep. There's REM sleep and there's non-REM sleep. And both have different physical functions, different brainwave patterns, and they're both essential. The typical, normal, healthy pattern is to enter sleep through light, non-REM sleep, and then go into deeper sleep, and eventually to go into REM. And you have periods of REM sleep throughout the night. REM usually accounts for about 20-25% of the night. The deep sleep is, again, usually about 20-25%. Deep sleep is mostly in the first half of the night. REM sleep is mostly in the second half of the night. But the pattern varies a little bit.
That's so fascinating. 20% doesn't seem like a lot.
Every stage of sleep is important. There are different physical events that occur and brain events that occur in every stage of sleep. So it all matters. REM sleep is the stage in which you dream. REM sleep is thought to be important for memory consolidation, for example. But deep, quiet sleep is very important for adjusting your metabolism, your blood pressure, cardiovascular function. So there's no one stage of sleep that's more important than another.
Absolutely, of course. Are there any new treatments or technologies that are showing promise that TPMG sleep medicine is incorporating?
When we have someone come in who has a sleep problem, then we will very often recommend testing to get more specific information about what's going on. The most common sleep disorder, as I mentioned previously, is obstructive sleep apnea, and we spend a lot of time diagnosing and treating that disorder. For sleep apnea, the technology's improved a lot over the years. There have been many changes. The typical sleep study that's done in a laboratory where brain waves are monitored and breathing and body movements, all of that still can be done, and we do it fairly often. But in most cases, when we're just looking for sleep apnea, and there's a fairly high probability of that, we'll do home sleep testing, which is much simpler and more comfortable for most patients, and also less expensive, which is important. So we have some home testing equipment that we use. There are a couple of different types of devices we have, but the one that we're using most often right now is actually a ring, which is very simple. It's literally a ring you wear on your finger. It has 6 sensors in it that monitor breathing, oxygen level, sleep pattern, and it connects to your cell phone. So the night you use it, you download an app on your phone and you turn it on and off from that. And it gives us very good data.
I feel like it would be better to read than a watch because a watch moves and it's not completely on.
Yeah, there really are a variety of different reasons why you record from different parts of the body like that. But through your finger, you can actually get a lot of good data about oxygen saturation and about heart rate. And that's particularly useful for monitoring sleep.
Well, I have to ask, do you use that stuff at home to kind of compare and check to see how it works? Do you use that on yourself?
Yeah, we've all played with that just to make sure that we understand how it works and how it feels for our patients.
Are there any new treatments that are showing promise, at TPMG that you would like to highlight?
We are still using CPAP as the primary treatment for obstructive sleep apnea. CPAP is continuous positive airway pressure. It's a mechanical device that's connected to a mask you wear on your nose. And most people who come in suspecting that they have sleep apnea are very familiar with CPAP and are dreading the idea of actually using it. And what we tell them is that the technology with CPAP, just like lots of other things, has really improved a lot over the years. The machines that we use are much smaller and quieter than the older ones. There are dozens of different masks that can be used to try to find something that's comfortable. Even people who are very claustrophobic, we can usually make them much more comfortable than they thought. But CPAP's not the only option. There are dental appliances that have really improved a lot over the years. We have dentists who we work with on the outside who can make and adjust appliances to hold your lower jaw in a more comfortable or more effective position to keep the airway open. Then there are different types of surgery that have been developed. One of the newest and most interesting ways to treat sleep apnea is an electrical stimulator device, which has been developed. You may see a lot of TV commercials for something called Inspire. The Inspire device is something that we do utilize. It is a stimulator. It's implanted under your skin. It's connected by a wire to the nerve under the base of your tongue. And so when you turn it on at night with a remote, what it does is it activates the muscles under the base of the tongue and stiffens them to keep the airway open. Now, that is not for everyone with sleep apnea. It does require a fair amount of testing before and after implanting this device to make it work properly and make sure that it's the right option for an individual. But we've had very good success with it.
That's
and
exciting.
I'm sure things will continue to develop in that direction.
That's so exciting. When you have a patient and you diagnose them, how do you know what treatments to use versus medication to prescribe them?
Well, it really depends on what the problem is. Sleep apnea is primarily a mechanical problem, and so the treatment for it is a mechanical treatment to keep the airway open. But there are lots of other sleep disorders that we do see people for, and sometimes sleep disorders run in bunches. You have one problem with your sleep and you pick up other things along the way. So a lot of people will have trouble with insomnia. They'll have trouble with body movements during the night. There are people who have sleepwalking disorder. Some people will have problems in REM sleep, especially older people with neurological problems. But it can occur in other settings too, where I mentioned REM sleep earlier as being the stage in which you dream. Normally when you're dreaming, your muscles are paralyzed, which is a good thing, so you don't act out dreams. But sometimes the system doesn't work quite right, and muscle tone will come back when it shouldn't, and then you can literally act out dreams. And it's mostly during violent or disturbing dreams, so people will be observed to be grabbing or punching or kicking or can fall out of bed. I mean, it's a serious problem, and we use medication to manage that. Sometimes it'll require sleep laboratory testing to monitor sleep and see what the underlying cause is. And it also depends on the frequency. I mean, if it's just once in a while, maybe triggered by, something else that's disturbing sleep, a viral illness or something like that, that's not so important. But if it's a more frequent, persistent problem, then we want to do something more about it.
I feel like the world of sleep medicine is never boring. You have so many different avenues that you can take, and it really just depends on the person, it sounds.
Yes. I mean, there is a lot to learn, a lot to do, and it's a field that I've really enjoyed being part of for my whole career. I think that public awareness of sleep disorders and awareness among our physician colleagues continues to increase. And as people become more accustomed to looking at sleep as an underlying cause for other medical issues, they'll seek treatment more often.
Now, Dr. Parisi, do you have any success stories that you would like to share with our audience?
And I can think of someone recently where this occurred. It was a young man who had a history of snoring and poor sleep quality, and so he was referred for sleep apnea evaluation and did have mild sleep apnea. But we treated him for his sleep apnea with CPAP, and the symptoms persisted. In fact, he complained that his daytime sleepiness was worse than ever, and he was having trouble staying awake at work and while driving. And then we asked him more questions about what was going on during the night, and he started telling us about some other problems he was having with the quality of his sleep and with excessive dreaming and some other issues. And this was concerning for narcolepsy. So we tested him in the sleep laboratory and found that he did, in fact, have narcolepsy as well as sleep apnea.
Wow.
And so we ended up putting on medication for narcolepsy, much rarer condition, but a very important one. And then he felt much better.
That's amazing. And that's a success story that you don't know until you come here.
Right. And that's why we really try to listen to our patients as well as we can to make sure that we're not missing any of those subtle clues that there's something else that we're not addressing.
And as we wrap up here, Dr. Parisi, quickly, you treat a variety of lung diseases as well as sleep disorders. Can we talk about how they are related and connected?
Yes. Well, people who have lung disease, who have asthma, COPD, any chronic lung disease that makes it more difficult for you to breathe during the day can also make it much more difficult at night. And so if you have respiratory disease in general, we always ask about sleep, and sleep disorders are very common in that setting. And it's important to treat the nighttime as well as the daytime.
Well, thank you so much, Dr. Parisi, for sharing your expertise. Any last words to our audience before we wrap up?
There's hope for you. Their sleep problems are very common, and it makes sense to pay attention to it because there's a lot that can be done. There's a lot of room for improvement in sleep habits. There are lots of sleep disorders that can be treated, sometimes easily.
Well, thank you, Dr. Parisi, again for being here. And thank you to our audience. To learn more about improving your sleep and staying updated with TPMG Health Talk, visit mytpmg.com. We look forward to exploring more health topics with you in our next episode. Take care.
The information shared on today's podcast is not intended to be medical advice, nor is it meant to replace a professional consultation with a healthcare provider. The opinions expressed in this podcast do not necessarily reflect those of TPMG or its providers and physicians.